my name is Tasha, and this is my volunteer. This is Aiden Perez. I am going to be recording this video as part of our neurovascular assessment, and this is for a nursing skills video for our course at Nightingale College. Okay, and this is a neurovascular assessment. All right, Aiden, do you understand and do you consent to participating in the skills demonstration and being recorded for our educational purposes and then having people review and grade it?
Yes.
Perfect, thank you. Go ahead and let me know on camera.
Yes, I consent to both participation and to being recorded.
Awesome, thank you. All right, so to start on this assessment here, I am going to make sure I do my hand hygiene, that we have the door closed for patient privacy. All right, can you just tell me your first and last name?
Aiden Perez.
And your date of birth?
6/19/2007.
Awesome. So today we're going to be checking your nerves and the blood flow and how everything works together. All right, and this is going to help me see how your nerves and your blood flow are working. All right, and it's also going to help me see the senses that your body does to touch, movement, and your balance. All right, so we're going to start with sensation. All right, so we're going to do let's try to see how you do with touch and pain and how you feel it, okay? So I'm going to start by doing something soft, and it's going to be something a little bit sharper. So I'll have you close your eyes for this. Thank you. Okay. All right, let me know if this is sharp or soft.
Sharp.
All right, thank you. And how about this?
Soft.
All right, let's try this arm. All right.
Sharp. Soft.
Awesome. So great. You felt both of those correctly, and it is telling me that your nerves are sending your signals normally. Now I'm going to check your position sense, and this is where I need you to close your eyes again. Okay, I'm going to take your foot, this one, thank you, and I'm going to have you move your toe. I'm going to move your toe up and down, and I'm going to do this on both sides. Okay, just tell me which way it goes.
Up.
Okay. And this one.
Down.
Awesome. All right, and this is gonna check to see how your brain senses movement in your lower body. Now we're gonna do the same thing on the top half of your body, okay? Close your eyes. Okay. So let me know if I'm doing up or down.
Up.
Okay.
Down.
Awesome, and now you did a great job doing that, and this is gonna confirm your upper body position and how your senses are intact as well. All right, so go ahead and keep your eyes closed. I am going to place something in your hand. I want you to tell me if it's familiar and just touching it, and let me know what it is, okay?
Coin.
Perfect. All right. Nice job. This is what we just did is called stereognosis, and this is how you recognize objects by feel. All right, now I'm going to use some Q-tips here, and I'm going to have you touch your fingertip with 1 or 2 points, okay?
Okay.
Let me see your... Let's see. Tell me what you feel. So 1 or 2 points.
2.
Okay. 1 or 2?
1.
Okay. Great, that's your 2-point discrimination. Keep your eyes closed for me. What I'm going to do now is I'm going to draw a number on your palm, okay? So I'm going to grab your hand, just right, like this, and I want you to tell me what number I'm putting in your hand, okay?
3.
Perfect. All right, and this is called graphesthesia. All right. The last thing we're going to do for our sensation is I'm going to lightly touch one of your body parts. All right, so let me, with your eyes closed, and I want you to tell me which body part I am touching. Okay?
My left shoulder.
Okay.
Right knee.
Awesome. All right, and this is what's called this tactile localization. All right, next we're going to do your reflexes. And this is so that we can see how your spinal cord and your muscles work together, okay? All right, so I'm going to, my reflex reflex hammer here. I'm going to have you relax your arm. I'm going to have you rest it here on me, okay? We are going to do this near your elbow. This is the tendon bicep reflex, okay? All right, and I'm just going to tap it, and there should be just a little bit of movement. All right, perfect. A little bend in the arm is normal. I did see that we got 2+ expected responses on that. All right, and so next we're going to do the patellar reflex. And this is where I'm going to tap below your kneecap. All right, so I'm going to come a little bit lower here. All right. Now just relax your leg, okay? Perfect. Thank you. You did kick out a little bit, and this would be what we would call is a 2+ response. And now we're going to do the plantar reflex here. And this is where I'm going to draw a shape on the bottom of your foot, and it's going to be a J. Let's see this here. All right, perfect. So if his toes were to curl under, which it did not, or stay still, which is what it did, these are both considered normal. Now, if they had fanned out, we would consider that abnormal. All right, so finally, I'm going to check for your ankle clonus. So what I'm going to do is I'm going to get your, here, I'm going to pull it up. You're a little tall for me. So what I'm going to do is I'm going to bend your foot upward and down quickly a few times, okay? Perfect. All right, so no jerking is normal, and it's exactly what happened, so which means he's got negative clonus. Any repeated movements would have been positive. All right, so now we're gonna do your coordination and balance, okay? So what I need you to do is close your eyes. Well, you can look at me now. What we're gonna do is you're gonna touch here and go out, touch here and go out, but we're gonna do this with your eyes closed, okay? All right. And you're gonna do it back and forth. Slower. Perfect, thank you. So he had nice smooth movement, which is good for cerebellar function. So now what I need you to do is take your hands, you're gonna go like this, and you're gonna do this back and forth, okay? Perfect. All right, that's gonna check for rapid alternating movements, and you did a great job. So now what I need you to do is you're gonna do this, you're gonna slide your heel down your shin for me. Awesome, good job. Do the other side. All right, and this is just showing that you have good lower body coordination, okay? So now we are going to do your gait and Romberg. So what we're gonna do is check your balance, and this is called the Romberg test. So what I'm gonna have you do is stand up. I'm gonna move out of your way here. I need you to stand with your feet together, arms at your sides. All right, and close your eyes for me as soon as your yawn is done, okay? So what I'm gonna do is I'm gonna time this for 1 full minute. All right. All right, I'm just gonna stay close to you just in case anything happens. So I am here, okay? And having a little bit of sway is normal. So if you were to lose any balance, that would be abnormal, but you're doing great so far. And I'm still here by you. You are doing great. We have about 25 more seconds, okay? Mm-hmm. Ten more seconds. You're doing great. All right, so we've done that for a full minute. All right, so now what I'm gonna have you do is I'm going to have you walk back and forth to the side of the room. Doing this, I'm gonna be watching your posture, the rhythm of your posture, and how evenly you step, okay? Go ahead and walk back and forth for me. Perfect, awesome, you did great. All right, every step looked amazing. All right, so awesome. Thank you for your participation today. This is gonna complete the neurological assessment. You did good. I would help my patient get comfortable again at this point. I would wash my hands. And I'm done with my demonstration. Thank you.